Tēnā tātou katoa, good evening. Just 2 days after we crossed the 1,000 cases a day threshold, New Zealand is on the verge of 2,000 daily COVID-19 infections, with 1,929 cases. Auckland again was leading the way with almost 1,400, but cases in the south are growing fastest. The southern districts have more than doubled since yesterday, with 77 cases. Canterbury's gone from 7 to 35. There are 73 people being treated in hospital, up 10 from yesterday, with 1 in ICU. Almost 33,000 people were tested in the last 24 hours. And as Alice Wilkins reports, the prospect of 10,000 cases a day is creating growing concern.
For almost 2 years, it feels like our lives have revolved around one single daily number, and that isn't changing anytime soon. This week, New Zealand joining the rest of the world in thousands territory.
New Zealand has recorded more than 1,000 new cases of the virus.
In March, experts say that daily figure could be 10,000.
We expect cases to increase approximately 8-fold in the next 2 weeks.
I'm just hoping we sort of reach a peak and come out of it.
It's not as scary as it was before, but we're still trying to be careful, for our families.
I think I'm concerned because I know people who are immune compromised.
It's going to continue, but live with it.
But many will feel the impacts. Today, Minister Sepuloni announced funding for 197 extra staff to help isolating whānau in need get support, as well as more than $80 million to assist food bank providers.
There are families that are going to need support to self-isolate.
More than 5,000 people are currently isolating at home across Auckland alone, and that's just positive cases, not close contacts. The Ministry of Social Development is concerned Kiwis haven't got themselves personally prepared and its services will be stretched.
Have a plan, who's going to deliver stuff to you, buy some things if you can. We think about 1/5 of the people might need some help. If we have to do up to 1/3 of the people needing welfare support, we're in trouble.
One thing New Zealanders have been doing, boosting. 370,000 got theirs in the government's Big Boost Week, but in total, just 64.5% of those eligible are done.
New Zealand's very well positioned to get through this Omicron wave in good shape. We can reduce the impact of this pandemic wave into something resembling a bad flu season, where we typically see about 500 deaths and about 3,000 to 3,500 people put in hospital.
As the COVID thousands start to look more familiar to Kiwis. Alice Wilkins, Newshub.